My name is Ana Schlosser. I'm a registered provisional psychologist here in Medicine Hat. A lot of the work that I do centers around understanding the impact of trauma that's occurring in their life presently, but also understanding how early childhood trauma impacts their adult wellness. Where I want to start is just in terms of understanding that all mammals, when they're first born, are born with skills to help them adapt to survive. For example, a foal will be able to walk within minutes to hours of being born. A snake, as soon as it's born, has the ability to bite. Human infants have the ability to cry, and this is their main method of communication and self-protection. From the first point of birth, we are able to cry for help or to try to access help. And so one of the things that we tend to do as we get older is we lose our willingness to ask for help or to receive or accept help. In the mid-90s, there was a very large study of about 17,000 people who had accessed their benefits and insurance. And through the course of that, they were able to communicate a variety of mental health conditions as well as physical health conditions. And so what we found with that study is that a number of factors impacts our wellness and health as an adult. And the premises of those comes from our experiences in childhood. What they also found with many of these people who were expressing concerns around their physical and mental health was that most of them had childhood adverse experiences. As we begin to understand the impact of childhood experiences and how that affects ongoing adult health and wellness, we have to have a better understanding of what adverse childhood experiences are. So adverse childhood experiences are a variety of experiences that children have that they don't choose, that occur in the homes and in the people around them that are responsible for raising them. These are things that happen that interfere with their development. It's the difference between various types of toxic stress, interference with healthy, normal, typical development. Adverse childhood experiences are something that can be preventable in some cases. For many children and families, one of the factors is the family's overall resiliency and addressing the adverse childhood experiences or the adverse experiences that they're experiencing as a family altogether. Skills are something that can be taught to many families. Accessibility to support services are something that can be provided to them. What we want to be able to do is to have a better understanding of the adverse childhood experiences themselves. There are three main categories of ACEs that are comprised of 10 experiences or 10 adverse childhood experiences that a child may experience through their life prior to the age of 18. Those consist of, in the category of abuse, physical, sexual, or emotional abuse. In the area of neglect, physical or emotional neglect. And regarding household dysfunction, we're looking at mental illness, an incarcerated person from the home, their mother being treated violently, substance abuse, and divorce. As children have experienced these, what we look for is the impact of those experiences over time, as well as just simply having the experience. One of the questions that we would ask, and we would encourage professionals and physicians to use in terms of screening to further predict what adult wellness may look like, is the following 10 questions. For each of the adverse childhood experiences that I'm going to read, I want you to give yourself a score of 1 for every yes that you answer to each of the 10 questions. And then you total your ones or you total your yeses for an overall score of the 10 questions. Did a parent or other adult in the household often swear at you, insult you, put you down, or humiliate you, or act in a way that made you afraid that you might be physically hurt? Number 2, did a parent or other adult in the household often grab, push, slap, or throw something at you, or ever hit you so hard that you had marks or were injured? Number 3, did an adult or person at least 5 years older than you ever touch or fondle you, or have you touch their body in a sexual way, or try to actually have anal, oral, or vaginal sex with you? Number 4, did you often feel that no one in your family loved you or thought that you were important or special, or your family didn't look out for one another, feel close to each other, or support each other? Number 5, did you often feel that you didn't have enough to eat, had to wear dirty clothes, and had no one to protect you, or your parents were too drunk or high to take care of you or to take you to the doctor if you needed it? Number 6, were your parents ever separated or divorced? Number 7, was your mother or stepmother often pushed, grabbed, slapped, or had something thrown at her, or sometimes or often kicked, bitten, hit with a fist, or hit with something hard, or repeatedly hit over at least a few minutes, or threatened with a gun or a knife? Number 8, did you live with anyone who was a problem drinker or alcoholic who used street drugs? Number 9, was a household member depressed or mentally ill, or did a household member ever attempt suicide? Number 10, did a household member go to prison? Those exposed to adverse childhood experiences are 3 times more likely to develop heart conditions, lung cancer, and up to a 20-year difference in life expectancy with the more ACEs that they experience. About 60% of people have at least one of these childhood experiences. 12.8%, or an eighth of people, have 4 or more of them. If you have 4 or more, you're going to be 4.5 times more likely to develop a depressive disorder, 2.5 times more likely to develop CPOD. You are going to be 12 times more likely to be at risk for suicide than someone who has 0 of these adverse childhood experiences. One of the things that we also see with ACEs is that we are more likely to engage in risk-taking the higher our ACE scores are, but that doesn't necessarily account for everyone. Even people who don't engage in risk-taking will still be likely to develop heart disease and cancer as they continue to age. One of the things that I want to make clear is that with the ACEs, children never choose their ACEs. These are things that happen or occur to them or around them in their homes that they're raised in. The other thing that I want to point out is that this is not an issue of choosing bad behavior. It's not an issue of ethnicity. It's not an issue of class. It's an issue that everybody experiences. And so even in the original study of the 17,000 participants, what we found was 70% of them were college educated and 70% of them were white. This isn't an issue of community members that are disenfranchised or things like that. This is an issue that affects all of us that we didn't choose. And if we aren't careful, then we will have struggles with that as we continue to develop through our lives. But because usually it will manifest initially in terms of a health condition or a mental health condition, we often don't connect the two from childhood to adult wellness. The ACEs are not fixed. You can not necessarily undo what you experienced prior to the age of 18, but what you can do is you can address those issues in adulthood or as you continue to develop. We know that sleep is like medicine, exercise is like medicine, connection is medicine. So medicine isn't always in the form of actual pills and medication, although it can be. And some people may need to do that temporarily. Some people may need to do that for long term to be able to continue their wellness in a direction that they feel most comfortable. You can also repair damage in terms of relationship dynamics by potentially engaging in therapy, but not every person is ready for therapy. They have to be stabilized enough to attend to therapy to make therapy effective. Supporting people, but also being patient with their stage of change is important as well, and can be really exhausting and sort of scary to wait for someone to be willing to change or ready for change. We tend to think of physical health and mental health in 2 different silos. At least for us here in Canada, healthcare covers conditions that are medical in nature, but then we don't necessarily have a system that supports mental wellness in the same way. Many medical professionals are very aware of the ACEs. Not nearly enough. We don't use ACEs as a screening mechanism when people go to the emergency room. There's increased buy-in by physicians to understand the ACEs and the impact that it has on their areas of expertise, that it's not something different, that it's often very interconnected. Mental health practitioners are becoming far more aware that autoimmune disorders, diabetes, cancer, osteoporosis, all these physical conditions that we normally would say, no, you need to go to your doctor for that. We understand that they're interweaved and they're very much enmeshed. We can't just treat people by focusing just on addictions or just on mental health or just on physical health, because what we know about addictions as well is that trauma almost always is the foundation of the addiction. It's an attempt to try to cope with the trauma when they don't have the effective skills to do it. With the ACEs, the main factors that are impacting children's development is in regards to child brain development, immune system development, hormonal development, and even how our DNA is interpreted and communicates. In the field of epigenetics, what we see is over time, intergenerational trauma will actually change the dynamic of the genetic makeup, which then directly impacts our resiliency and our ability to cope with adverse experiences. When kids live in a chronically stressful environment, what occurs is that their adrenaline goes up into a fight or flight response. And if they have the ability to flee, then their adrenaline will come back down. Or if the pressure of the environment comes down, then their adrenaline will come down. But children who live in ongoing chaos don't have the ability for their adrenaline to come back down. So what was meant to be protective and help promote their health and wellness will now become maladaptive and life damaging. We see the same thing in first responders. When they are in ongoing chaos and crisis situations, their adrenaline doesn't come back down. And so we end up with the result of PTSD-like symptoms, hypervigilance, anxiety, sleep disruption, and we see the same thing in children as well. And part of that's because their executive functioning skills, their impulse control ability is compromised, and so they may not be able to focus, they may not be able to learn very effectively, they can't remember rules or expectations, they have impulsive behavior. We know that children are more susceptible to damage from the ACEs because their brains are continuing to develop. Stress affects the brain and its development and functioning, but also immune systems, our ability to fight off illness as well as to protect us from virus and things like that. Treatment reduces the effects of the ACEs by us utilizing evidence-based practices and a multidisciplinary approach. However, if we don't have effective screening, for example, child checks, things of that sort, then it's going to be really challenging for us to intervene. As therapists, they often will, as part of their initial intake assessment, be able to screen children for adverse childhood experiences, but even as working with adults who've experienced trauma, it's really important to do an ACEs screen, even though these events have already occurred in someone's life, because it can give you a bigger picture on how to intervene holistically, not just in regards to physical health, but to mental health as well. One of the things that we want to be cautious of is that we don't actually have a particular type of medication that can mitigate these effects. What we have to do is we have to engage in proper screening and assessment, and then also holistic multi-systemic interventions to be able to teach people the skills to have positive outcomes and wellness. When I first learned what the ACEs were, that having a better understanding of the impact or the potential impact that my own ACEs could have on me as an adult was really important. I had already been a clinician for many years. It changed how I understood myself. It changed how I understood my clients. It changed my ability to feel hopeful and to work with trauma and to create and instill hope in others. Very rarely do I meet someone who does not have at least one ACE in their own upbringing and childhood. Even myself, I have a score of 8 ACEs. So by all means, predictability wouldn't be that I would be a professional working, being self-sufficient, being able to function. There are times when I cope better and there are times when I don't cope as effectively. And so my own understanding of my ACEs, my own understanding of what my preventative ACEs are, has been really instrumental in my ability to cope and function despite what I've already experienced. Understanding the ACEs is no different than having a seatbelt in your vehicle or putting plug-in covers on the outlets in your home to protect a baby. What the education does around understanding the ACEs is allows parents to have information to mitigate the changes that need to occur, as well as to defend against the outcomes of some of the circumstances that contribute to ACEs that are even without a parent's control. From the perspective of trying to build hope and moving forward in regards to families that have experienced a high number of ACEs or even just one ACE, it's really important to understand what are those factors that can help prevent the long-term impacts of the ACEs. For example, I'm going to share with you a questionnaire called the PACEs, which is the Prevention of Adverse Childhood Experiences. Again, you would give yourself a 1 to any of the questions that you answer yes to. The higher number of PACEs, the more resilience we see present in the individual. For number 1, did you have someone who loved you unconditionally, that you did not doubt that they cared about you? Number 2, did you have at least one best friend, someone that you could trust and have fun with? Number 3, did you do anything regularly to help others, such as volunteering at a hospital, nursing home, or church, or do special projects in the community to help others, such as food drives or Habitat for Humanity? Number 4, were you regularly involved in organized sports, such as soccer, basketball, track, hockey, or any physical activity, competitive cheerleading, gymnastics, dance, or marching band? Number 5, were you an active member of at least one civic group or a non-sport social group, such as scouts, church, or youth group? Number 6, did you have an engaging hobby, an artistic or intellectual pastime, either alone or in a group, such as chess club, debate team, music, vocal group, theater, spelling, or did you read a lot? Number 7, was there an adult, not your parent, that you trusted and could count on when you needed help or advice, such as a coach, teacher, minister, neighbor, or relative? Number 8, was your home typically clean and safe with enough food to eat? Number 9, overall, did your schools provide the resources and academic experiences you needed to learn? And number 10, in your home, were there rules that were clear and fairly administered? With the PACEs, any of those questions would be sort of like a prescription for any of the ACEs that you may have answered to. This idea that prevention of the ACEs is not that you have to wait until after you're 18 to do them. You can start them at any point. If you know an individual who's struggling, who is having experiences in their home, maybe you're a teacher or a principal or a counselor, you have the ability to be any one of those things for the child that you're interacting with. The other piece to that is to be that person for their parents as well, because parents, just like children who experience adverse childhood experiences, often grew up in homes that were similarly functioning, but also as parents, we experience immense shame around not being able to provide our child with the life that we hope that they would be able to have. What we know about parents is that they often parent the way that they were parented. And so in order to change those patterns, we need to be able to support the parents as well. What we want is to be non-judgmental. We need to be able to communicate openly and honestly and empathetically with a parent, to be able to provide them a safe venue for them to either speak with someone that they feel supports them and understands them, or to connect them to those resources. Accessibility is often important as well for parents, to be able to have access to the proper supports. Sometimes it can be overwhelming if we try to expect a parent to participate in many services all at once. One of the ways that we can be more fluid and clear with a parent on supporting them is to try to train the professionals that are particularly physicians. Parents often will take their children in for well child checks, and if the physician's trained, then we're able to provide the parent with a meaningful contact, at least initially, so that the physician can make the proper referrals and recommendations to that parent. Someone once told me that hope stands for hold on, pain ends. When we have hope, we're able to bridge the gaps between what was and what can be. We often would talk about trauma in the early days as something that happened to you. You couldn't change it. There was nothing that could be different. But now the way that we talk about trauma is in relation to prognosis, in relation to later health and wellness for adults, but also in terms of realizing that we don't have to accept that what happened to us is who we are. The adverse childhood experience is not necessarily, a life sentence. It's not your destiny. It's just something that has occurred that has had an impact on you, but that overall, over time, skills can be built to build resiliency in regards to those effects. Resiliency is something that can be built. You're not just born with it. It's something that you practice every day. What we want is for people to be able to reach out and connect. Being able to ask for help is essential to being able to have resiliency in one's life. Educating parents is really key in being able to prevent further damage from ACEs. Many families don't have any awareness of what ACEs are, and therefore they can't change their behavior. However, what we see in terms of treatment and evidence-based practices is that being able to provide education to parents on how to change their behavior and to provide them the support services to facilitate that change is really impactful in preventing further damage or any damage regarding ACEs. What we do see is that intergenerational trauma affects children on the long term in regards to their parents' ability to cope and overcome their own experiences with trauma. We have to be able to treat a family holistically, not just a child. And although we can medicate family members, pills don't teach skills. And so we still need to work with families on the skills needed to build resiliency and to have effective coping and emotion regulation in order to have positive outcomes down the road. One of the greatest skills you can have as an individual in general is emotion regulation, the ability to manage your own emotions in the face of adversity. Adversity is not preventable. We all experience it at different times in our life, some of us more than others. An analogy I like to use in therapy a lot is pilots of an airplane. If the plane is hitting turbulence, what you do as a passenger is you look to the stewardess, you look to listen to the pilot to see how are they acting when things are going to be rough. If the pilot of the plane or the stewardess are freaking out, then the passengers on the plane are going to be freaking out. In this analogy, parents are like the pilot of the plane, the stewardess, and the passengers are the children. When children need to be able to cope effectively, they need to have that example modeled to them by their parents. Part of that is helping adults and parents understand the role that they can play in supporting a child, but also just they themselves being able to self-reflect on the choices that they've made in their life, the experiences that they've had in their lives. It can be difficult to sit and reflect on your own behavior. Guilt often is a part of that experience. So we have to be really cautious not to stay stuck on what has already occurred. We often can see depression as a result of feeling immense guilt. Guilt and shame are not necessarily the same thing. Guilt is when someone feels bad about a behavior, whereas shame is more that they themselves are bad. We don't want to get caught up in too much guilt, but a certain level of guilt is necessary in order to create change. So we have to be willing to self-reflect to the point where we can acknowledge what level of control we have in a situation. And when we aren't sure how to create change, we can seek out support such as therapy or parenting skills or guidance or recommendations from other parents on how they've been able to create change in their home. There's also really wonderful programs such as Parent Connect that allows parents to reflect on their parenting and how they're interacting with the children in their home. One of the questions to ask maybe when you hear of a loved one who has some sort of significant mental or medical condition is to wonder what happened. What happened to them earlier in life that their body changed and wasn't able to adapt to certain conditions or maybe made them susceptible to certain conditions. What changed? Get curious versus blaming, because that doesn't change anything. But being curious can create compassion, it can create dialogue and communication and vulnerability. When someone asks you about what really matters to you, what's really affecting you, that vulnerability opens up and it deepens the relationship that we have with one another. If you're terrified to ask your kid why they're suicidal, then you're going to have an increase in suicidal thoughts. But if you ask your child, why are you suicidal? Then you may be able to prevent that. This idea that if if we talk about it, then it's going to happen, is actually been disproven time and time again. If we talk to kids about having sex or protecting themselves sexually, that doesn't mean they go out and do it. It actually means that they're educated and they make more informed decisions about not going out to do it. The same thing applies for trauma. If you have a child who doesn't seem to want to be talking openly, then find them someone that they will feel more comfortable. Sometimes as a parent or as an adult in a kid's life, it doesn't even have to be your own. You could be, an auntie or an uncle or a family friend or something. But if we ask them, hey, do you need to talk? How can I help you open up? Let's get you someone. Sometimes it's not giving them an option to talk, but maybe it's giving them an option of who to talk to. And the same thing applies for adults. It's really difficult sometimes to engage adults in trying to get them to have conversations that are tough. Being able to offer to support them, go with them, help them find a therapist or a doctor or someone that they would feel more comfortable talking to. You can go with them. You can wait for them in the waiting room so that they don't have to do it alone. One of the things that is really hard for a lot of people who have extensive trauma or extensive health conditions is that they become very overwhelmed very easily. They don't have the ability to manage multiple things at once when they're feeling so terrible. If you have chronic pain, inflammatory body issues, then the last thing you want to do is get up and go for a walk. But maybe if you got up and went for a walk around the block with a friend, you might be more likely to do it. So this idea that if we wait for people to be ready to talk, we can be waiting a long time, but if we offer to do it with them, they might be willing to do it sooner. Therapists, doctors, psychiatrists, friends, family, they can help guide you, but sometimes people are too intertwined in the emotional piece of it to be able to give you some direction on how to change your life for the better of your own health. That's the part that gets so tricky, is how can we have really tough conversations with respect and with dignity and without polarizing. We live in a culture right now where if you're not with me, you're against me, which is so challenging because we can't hear each other when we do that. We can't absorb something that someone else might be saying. In relation to COVID, a specialist named Kevin Cameron talks about the idea of closeness-distance dynamic. Kevin is an expert on trauma systems and particular events that create stress and adversity for individuals and families. One of the things that he talks about in relation to closeness-distance dynamic is that too much closeness can create anxiety amongst a family system, and too much distance can also create anxiety within a family system. A family that may have been coping well prior to the pandemic will now be struggling potentially with how much they're spending time together. Whereas a family who had maybe been struggling prior to the pandemic, maybe there was abuse or addictions in the home, is going to potentially be suffering even more so because of the anxiety of being locked down together too much. It's important for all of us to understand our own tendency to need certain levels of separation, but also certain levels of closeness. This is also important in relation to working with children. They need to understand their own needs for closeness and distance. So anytime, even in a partner relationship, if you don't understand your need for closeness or distance, or your partner doesn't understand their need for closeness or distance, we can take it really personally when someone doesn't want to be close to us, especially if we are wanting to be close to them. Individuals who can function as their own individual within a partner relationship tend to do much better with the idea of needing closeness and distance. For example, if your partner is needing space from you, but you are healthy in regards to your own needs for separation and distance, you don't take that personally and you're able to give that to them. And then when you come back together, you're able to feel more connected. But what happens with family systems or children who require a lot of closeness is that potentially you're an overwhelmed parent and you need some space just to breathe, to take a bath, to have a shower, to eat, to have some silence. What happens is children's anxiety systems will go into activation because they're not able to get that closeness that they're seeking. I think we would all agree, and Kevin says the same thing, that no two people are alike, even within a family system, the same family system, on whether or not they require the same level of closeness and distance. One of the things that we can do when we are struggling in a situation where our need for closeness and distance is different than the person that we're interacting or dealing with is that we can just communicate that it doesn't necessarily mean that we don't like them. We can clarify what we're experiencing. Maybe we just need a little bit of quiet. Maybe we just need to get some physical activity, a quick walk around the block. If we can explain to them that our needs aren't about them, especially if it's two adults, if you can communicate that need to one another, then it's going to be much more beneficial to be able to get that versus expecting the other person to sort of mind read. What I'd like for people to consider is that you don't have to have depression to understand that what you've lived through is impacting you. You can look at your physical health, diabetes, cancer, osteoporosis, all of those different illnesses are connected to our body's ability to adapt to adversity. And so that might be emotional adversity, that might be physical adversity, but what we know is that chronic stress impacts our ability to fight illness. This is where autoimmune disorders will get worse when someone has something like fibromyalgia or irritable bowel syndrome and they become stressed, their symptoms flare. And so there's a direct connection between what we know physically in our bodies and what we know emotionally. And sometimes our body will give us signals physically first that something is not right emotionally, and other times we might have the emotional experience first, and then ongoing problems emotionally can sometimes result in compromised health, more in a physical sense. It's okay if you're experiencing one versus the other to be able to look into that further, to get guidance and support, because even when you're physically unwell, you still need emotional support to be able to cope with that chronic illness. Emotional support is the safety net of our ability to be able to function through any kind of adversity. Emotional intelligence is the number one predictor of how well we will come out of a situation that's been challenging to us. And if we can model that to children, then we're equipping them to do something that is much harder to do as adults. I find children to be very articulate. They're very aware because of the efforts of our community, of our systems, of our education programs to be able to teach children to communicate more about their needs emotionally. But we also need to help them understand by modeling to them that even as an adult, we can learn to change behavior for our own wellness and for theirs. We have a responsibility as adults to change patterns of behavior. It may not be our fault why we need to do that, but it is our responsibility to do it because it will help change the pattern of future generations. We have to take responsibility for some of it. I'm not saying that any one person is responsible for all of it or needs to admit fault in any way, but what needs to occur is that parents need to be willing to reflect on how they can parent differently. Adults need to be willing to commit to making change in their lives in order for these things to not continually affect children. There's a level of responsibility that children don't have in changing what they're experiencing, and so it has to come from the adults. And it may not even be your child that you're trying to change a pattern of interaction with. It may be the kid next door that you know maybe doesn't have the greatest home life, or it may be a student in your school. Simply by having loving, caring, consistent relationships with children, we can immensely change the outcomes of what they have experienced as well as what they will experience moving forward. Trauma often occurs between people, but it also heals between people. The sense of connection is what actually helps us overcome the damage of what's occurred. We have this process in therapy called the power of one, which basically implies that everybody only needs at least one person in their lives that they can have a trusting, nurturing relationship with that will completely change the game for them. For myself, it was a high school counselor. I had been experiencing some struggles with my mental health as a grade 10 student, and as a result of some of those emotions, I made choices. I made choices that were harmful to me. I made choices that impacted my family system, and as a result of that, I had to see a counselor. And that was instrumental in changing the course of my life. Had you asked me before I met that person whether or not I could see myself being a professional or even going to college, I would have said no. They gave me that opportunity to see a future that I couldn't see on my own. This is a poem by Portia Nelson that I think summarizes the conversation that we need to be having about how do we actually create change around our own behavior as adults. This poem has 5 chapters. Chapter 1, I walk down the street, there's a deep hole in the sidewalk. I fall in, I'm lost, I'm helpless, it isn't my fault. It takes forever to find a way out. Chapter 2, I walk down the street, there's a deep hole in the sidewalk. I pretend that I don't see it, and I fall in again. I can't believe I'm in the same place, but it isn't my fault. It still takes a long time to get out. Chapter 3, I walk down the same street, there's a deep hole in the sidewalk. I see it's there, I still fall in. It's a habit, but my eyes are open, and I know where I am. It is my fault, and I get out immediately. Chapter 4, I walk down the same street, there's a deep hole in the sidewalk. I walk around it. Chapter 5, I walk down a different street. I hope that people will hear the conversation and choose to walk down a different street, choose to make changes in their lives, even if someone didn't do that for them, that they can be that person for someone else, and particularly a young person, because that is our future.